Our sixth early stage company is from right here in Bend, Oregon, Osheru, a device that simplifies upper eyelid surgery to make this vision and appearance enhancing procedure available to anyone. Welcome, Osheru.
Thank you. Hi, I'm Dr. Patricia Bueller from Bend here. I've been a surgeon here for 30 years, an eye surgeon. And during that time, I've done thousands of blepharoplasties. What's that? It's a surgery that removes unwanted upper eyelid skin, which improves patients' peripheral vision by up to 25%, as well as making them look younger and more revitalized. There's 350,000 of these procedures done in the US each year and 1.6 million worldwide. The problem with traditional blepharoplasty is it can take up to an hour to perform at a cost to the patient of $4,000 on average. There's bleeding requiring cautery and wound closure requiring suturing, and the patient can have disfiguring bruising for up to 2 weeks postoperatively. Despite these problems, there's been little innovation in this area for decades. My innovation insight came when I was at an ancient Egyptian medicine exhibit. The Egyptians removed that fold of extra skin by compressing it between two small twigs, and that devitalized tissue without a blood supply would fall off within 3 to 5 days. Similarly, there's devices on the market for skin tag removal and circumcision to remove unwanted skin without surgery. Based on this idea, I designed and patented the eyelid lift device. With the eyelid lift device, we reduce bruising and bleeding and eliminate cautery and suturing. A procedure that takes 60 minutes to do, we can now accomplish in less than 10 minutes. Here's how we get such great results. The eyelid lift device fits the contour of the orbit perfectly so that we get symmetric and accurate removal of skin from both upper eyelids. There's a jaws that compress as well as a cutting mechanism that removes the extra tissue so that tissue glue can then be applied. In 2021, I formed a company called Osheru to market and commercialize the eyelid lift device. We have a very experienced executive team that has medical device experience in bringing devices to market. We have a patented prototype. We've done proof of concept in an animal skin model, and we've done 3 cadaver labs comparing our eyelid lift device to traditional blepharoplasty. And we've demonstrated that our device is superior in shorter surgical times and better symmetry. Next, we plan to launch our FDA Class 1 product in second quarter of next year. And over the next 5 years, we hope to get 5% of the market for blepharoplasty, which is a $5.2 billion market right now on an annual basis. And our disruptive technology will help bring this vision and appearance enhancing procedure available to many more individuals. I hope you'll vote for Osheru's eyelid lift device.
Patricia, this is amazing. Truly amazing. I think Jen has a question for you.
I mean, other than like, where do I get one?
Where can we sign up?
So, Dr. Bueller, I know that blepharoplasty is not just a cosmetic procedure. It's also done for a number of medical reasons, ocular pressure, their thyroid patients. I mean, is there anything does this have to be a cosmetic procedure, or is the goal to sort of improve eye surgery on a holistic level? Or what do you see as the go-to-market?
Yeah, so there's 350,000 blepharoplasties done in the United States each year, and 1/3 of those are considered functional and paid for by insurance companies. So 2/3 are considered cosmetic and paid for out of pocket by patients. But this device will be available for all of those procedures.
And is it just upper eyelid or lower eyelid? Like, I know that's a separate, different type of procedure, but do you see an opportunity to address that issue as well with under eye bags?
Well, our current eyelid lift device is really for the upper eyelids, but we have lots of plans for potentially using it on the lower eyelid, the cheek, the jowl, the forehead. So I think there's lots of opportunities for the innovative technology to be used in other areas.
It's just very, very cool. Okay, questions from the audience. Okay, and
I've got one.
Go ahead, Steve.
It's over there. Take it.
Yeah, you go ahead.
The mechanism is quite ingenious. Does it have to come in multiple sizes to accommodate various people?
Actually, so we've done cadaver studies with our device, and we started with a what was in the literature from anatomy from people, and so the device is actually measured and works on most everyone. We've got in our cadaver studies about 95% of people of the cadavers, and these were all actually mostly white cadavers and elderly, but it fit on almost everyone. There will be individuals that, due to their anatomy, it won't fit, but you don't need various sizes to accomplish what you need to accomplish.
Can I ask one
Yeah,
more?
please, go ahead.
Is this technique being used on any other kind of surgery? Like, or is this so I guess my question is this a de novo 5 application, or is it a 510K because someone else is also slicing and surgical gluing skin?
No. So currently blepharoplasty is done with a blade and scissors and cautery and regular old sutures. So no one is doing the surgery this way for blepharoplasty. A few people have tried using tissue glue, but it hasn't been successful because it doesn't have our patented jaws that keep the tissue together in order for the glue to work.
This is amazing, Patricia. I am so excited to see what happens next. Thank you. Beautiful pitch.
Well,
Thank you.
Thank you.